I'm joined by Labour MP Meg Hillier, who is also the chair of the Public Accounts Committee. Good to see you this evening. Thanks very much for your time. Just explain to me when you first heard about and saw for yourself the problems that we've been hearing about over the last couple of days.
Well, there was known that was a potential issue with this back in the 1990s, with a warning, particularly in 1999. But more recently, there was a failure in a school in 2018-19. That led to hospitals and schools in particular doing major surveys or having surveys done. But the school surveys were really taking place mostly this year. There were 600 planned. When we saw the Department for Education in July, they'd done 300 of those surveys. And that has obviously led to discovery of worse problems than were previously expected. But it's been known for quite a long time, that nearly 25 years, that RAAC was something that needed to be watched very closely, at the very least, and as time's worn on, that it was a potential risk.
And as we've been hearing, not just schools, but also the likes of hospitals are in danger as well.
That's right. There are 7 hospitals that are built entirely of this material, which will cost an average of £1 billion each to replace. And then there are over 40 buildings and 23 trusts in total that have some of RAAC concrete in them. So there is a really big issue for them, and it's costing hundreds of millions of pounds. The government set aside over £800 million just to mitigate the issue of RAAC in hospitals. And my committee visited one in July, and it was really eye-opening and amazing and shocking to see the amount of money being spent to survey and x-ray indeed some of the blocks. Some blocks didn't even have the reinforcement all the way through from end to end, and there are weight issues, so people can't go on the roof, and some patients can't be treated in certain parts of the hospital in case there is a catastrophic ceiling or roof collapse. So this is having a big impact for those hospitals most affected, and and it's also very expensive for the taxpayer.
And of course, because this problem has come to light, it's going to push back the wider maintenance timetable, isn't it, and the replacement of buildings. So it has a knock-on effect as well.
Yeah, with the schools programme, which we'd looked at in July, they had reserved 100 places for the new school building programme for schools in this sort of position. But of course, we know there's over 100. Some will only have cupboards, so it does depend on the school what needs to be spent. But that's what we have seen, and my committee's highlighted over a number of years, is the lack of capital investment in schools and hospitals. And we're the committee that wants to see public money spent, taxpayers' money spent wisely. And sometimes spending it early means you're saving money later on. And we are now seeing a big backlog in maintenance in schools that were in a better condition, which will obviously, as you say, now have to wait. And let's be clear, 700,000 pupils are currently being taught in inadequate buildings, and that's only a small percentage of those are in buildings with this reinforced concrete.
Yeah, I mean, it's been estimated that only 24 schools in England have been told to close so far. We don't know for sure because, of course, that list hasn't been published. So 24 out of 22,000 schools. Is there a danger that there could be some overreaction in all of this? I mean, clearly for those schools affected, it's very serious, but the vast majority of schools won't be.
No, I think if you were a minister and I were the minister and you thought there was a piece of concrete was going to fall on a pupil's or teacher's head next week, you would be naturally cautious and want to support those schools. And the head of the Department of Senior Civil Servants said very clearly to us in July, where there is a risk issue for pupils or teachers, the government would step in, no question. So they were very clear about that then. At that half point, they were halfway through the surveys of the schools with this problem. But look, there is a bigger issue here about school maintenance generally, which is what my committee was looking at in July, more than just RAAC. That is the 700,000 pupils in inadequate schools. And, Michael Gove, of course, was the education chief, or Secretary of State 13 years ago. And he says now that he regrets stopping the then school building programme. And again, my committee looks at big programmes all the time, and stop-start on these sort of major transformation programmes isn't very cost-effective, leaves things in limbo, and sometimes can lead to these problems, though that's not necessarily what's led to the problems with RAAC. But it is not a good or effective way of spending a valuable taxpayers' money.
Yeah, and I suppose we can't just point the finger at this government, can we? I think you wrote in the Times today that concerns were raised as far back as 1999 about this concrete.
Yeah, 1999, there was then the professional body raised a concern that roofs, particularly with this aerated concrete needed to be regularly tested for safety purposes. But as time has gone on, and it was in 2018 and 2019 that very serious issues first arose, and that's when the surveys of hospitals and schools began, really, and particularly hospitals were better able, let's be clear, because they've got estates departments to do this sort of work. But if you're a small primary school, it's a huge cost, it's a huge challenge. You don't necessarily have the expertise on your governing body, and it depends who the responsible body, the education authority is, whether they've got that capacity. So that's partly why the Department for Education stepped in. But one of our concerns as a committee is we want visibility on this. Whether it's schools or hospitals, you need the department in Whitehall to know what the scale of the problem is across, in this case, England, which is what we've been looking at. But obviously we now know there are problems in other parts of the UK. But where the department's got a responsibility, it needs to know what that is so it can plan and budget where government needs to step in and use taxpayers' money centrally to support schools or hospitals locally.
Yeah, it's so frustrating for parents, isn't it? They've had kids at home during the pandemic, they've had kids at home because of strike action, and now, so close to the beginning of the new school year starting, they're faced with the same prospect.
I know, it is devastating for those pupils, teachers and parents, and very complicated. If you're going back to work after the summer holiday and now you find you've got children at home, it's really tricky. And even though there are plans by the Department for Education spoke to me this week to tell me that they have plans to, and had sort of put a hold on getting temporary classrooms, that they were sort of first in the queue for them, if you like, to help schools. If you haven't got the right grounds to put them on, or you haven't got the space, you're really putting a lot of people. If you just can't educate, you can't use the dining hall or the toilet block. These are really big challenges, just as you're hoping to start a new school term. My heart really does go out to them. And this is why on the committee we talk about long-term planning, managing risk, which is something we've been very much focused on, planning ahead so that we can do as much as possible to mitigate the risks that we've seen with RAC.
And do you think the government needs to publish this list of schools affected immediately?
Well, I don't think there should be any reason why it shouldn't. I can see that maybe in the first instance they wanted parents and head teachers indeed to know directly before it was all speculated about and people were panicked about their school closing. So I think that's not a complete surprise. They didn't release it immediately, but I can see no reason why ultimately it shouldn't be. I think it's probably possible to put it together from certain public sources. So I'm a bit surprised about that reluctance, but I would envisage that we will see that list published in the coming days, and certainly there's going to be political pressure indeed from my own party and others to do that.
Yeah, and we heard about this beam, and you've mentioned it as well, that did collapse and has sort of sparked fears. I mean, do you worry that that could happen again in a public building that hasn't been checked or has been checked and people haven't been evacuated?
Well, when we went to visit the hospitals, if I can reassure viewers, we were very impressed with the amazing work they were doing on mitigation. Very costly. I mean, millions of pounds to do an X-ray or a survey of parts of the building in cases. And this is these 7 hospitals and a total of 41 buildings are costing a lot of money. But they are working very hard to make it safe. But it's almost, whatever the cost, because these hospitals have to keep running until there's a replacement. Similarly with schools, and I think it is important. Safety has to be paramount. But these buildings are reaching the end of their life, even if the concrete itself wasn't failing, they were going to be coming to the end of their life anyway. So that we need to really see a ramp up of the replacement of those hospitals with RAC and schools, of course. But we're now seeing a real urgency for schools, and it's going to be difficult to get it all done in time. You've got to have the right surveyors, the right construction people, and all of that, as well as the logistics. So it's going to be really challenging for those schools most affected. And as I say, my heart goes out to them, and we will keep a very close eye. And I should say on Thursday we'll be talking to the Department of Health about hospitals in particular, including hospitals with RAC.
OK, excellent. Meg Hillier, MP, Chair of the Public Accounts Committee, we appreciate your time. Thank you very much.